You know, there's so many people that have an issue with losing weight, and they get to the point where they're just so obese that just simply changing their diet doesn't work very easy, and they may have to turn to surgery. Well, today on the show, we're at the Singing River Health System's Weight Loss Center in Gulfport, talking to Dr. William Berglund. How are you, sir?
Nice to see you.
Nice to see you. Give us a little bit first, a little bit of background about yourself.
So I'm originally from South Carolina. I went to Hlsm University.
Yay, Tigers.
Then I went to down at Medical University of South Carolina in Charleston and got my MD and my PhD. Then we came to the Gulf Coast, my whole family and I, to fulfill my commitment to the Air Force.
Thank you for your service.
Appreciate that. Over at Keesler Air Force Base. And I just finished my commitment, separated this spring, and now I've been at Singing River Gulfport for the last few months.
Well, as I mentioned, you know, the thing is, Mississippi is known for obesity. We're number one in the country for obesity. Number two, number one for type 2 diabetes. And you know, a lot of people out there, they want to lose weight, but they just can't discipline themselves enough to do what it takes. And that's when they have to turn to surgery. Tell us, what exactly is bariatric surgery? So
bariatric surgery is elective surgery for weight loss. And the reason for, just like you said, Mississippi is number one in the country as far as the rate of obesity. And obesity is the number 2 leading cause of preventable death. And what we see is that bariatric surgery is extremely effective at not only helping people lose weight, but also to decrease those comorbidities that go along with obesity. Those comorbidities being diabetes, hypertension, heart disease, those types of things.
What bariatric or weight loss services are offered here at Singing River's Weight Loss Center?
Absolutely. So there's the medical aspect, which I think is covered in a different segment, but also the surgical aspect is we offer 2 different types of surgeries here. We offer the gastric sleeve, which is, I'm sure many of your viewers have seen or heard about. That's our most popular surgery. Now, these surgeries are all done laparoscopically or robotically. And then we also offer the gastric bypass.
Now, the technology has come so far to where, you know, you can go in there and do all that stuff and hardly even leave a scar anymore, which looks great.
Absolutely.
What qualifies someone to be a good candidate for bariatric surgery?
Absolutely. So there are objective measures. The thing we initially look at is something called BMI. That's body mass index. A patient with a BMI greater than 40, even without comorbidities, will qualify for bariatric surgery. And your viewers, they can go on to any website and plug in their height and their weight, and they can find out their BMI. So anyone over 40 will qualify automatically. Now, anyone between 35 and 40 with a comorbidity that's associated with their obesity will also qualify.
Now, what is a comorbidity?
Great question. So comorbidity is something like diabetes, hypertension, high cholesterol, heart disease, joint disease, those types of things.
So if they have problems with that, they might not qualify for the bariatric surgery, right?
No.
Oh, they
would. They will qualify.
Oh, they will.
If they have,
good job. Good.
Right. If they have a BMI between 35 and 40 and one of those comorbidities, they will qualify.
Now, how long does the procedure take?
So it depends on what procedure it is. So of the 2 that we offer here at Singing River Gulfport, first being the most popular one, like I said, the robotic-assisted laparoscopic sleeve surgery. That is where we actually remove about 85% of the stomach. It's a restrictive surgery, meaning we actually make the stomach very small, so you only can eat a very small amount. That surgery takes about 2 hours.
Right.
The recovery time afterwards, you're in the hospital for about a day. We usually tell people to take about 2 or 3 weeks off of work. And usually they're back to their normal routine within 2 or 3 weeks.
Now, here's going to be their big question. How long is it going to be before I see results?
Oh, so it's amazing. They are going to see results right away. In fact,
really?
They're even going to see results before the surgery because we have such a multidisciplinary team here. They're going to meet with nutritionists. They're going to meet with the doctors and meet with all the nurses and staff here. And we actually get them on a weight loss program even before the surgery. And then once the surgery happens, we really see that accelerated. I
was going to ask you, what type of results are expected from the treatment?
Yeah, so with the sleeve, we see about 60 to 70% of excess body weight loss. That means if you take your ideal body weight and then subtract it from your current body weight, that's going to be your excess body weight. And with the sleeve surgery, we usually see about 60 to 70%, and with the bypass, it's about 70 to 80%. And I tell all my patients, that's just the averages. I've seen patients who can do 100% of their excess body weight. It really is up to them.
Now, once they do this, I guess they start losing as far as the obese part of it, or is that something that they'd have to get lipoed out or something, or is that part of it?
No, so over time, as they lose weight, that their bodies will start to shrink down. And I always tell patients, this is a tool. It is a powerful tool, but it is just a tool. And when you asked earlier about what type of patient qualifies, not only do we look at BMI and those sorts of things, we will look at the patient who's motivated, who has tried things in the past for weight loss, whether it be diet, exercise, those types of things. These are the patients who are going to do well postoperatively, in that they are going to go out there and continue those diets, continue the exercise. But this is just a great tool to give them in their, to help them along the way.
And I've had so many people ask me, well, what kind of pills can I take for the? There's no magic pill. There's no magic pill for something like this.
Right, absolutely. And what we see, the data really bears that out. So what we see is when people try the pills, exercise, the fad diets, the keto, those types of things, they actually will get 10% of their excess body weight, and they'll lose that 10% of their excess body weight, but the failure rate is about 99%.
Really? Right. That high?
But with bariatric surgery, our failure rate is about 15% or less. So we see, we're talking about 99% to a 15% failure rate between surgery and conservative measures.
That's quite a big difference.
Absolutely.
Okay, somebody wants to find out more about it and see if they qualify. What do they need to do?
Absolutely. So there's two main ways. The main first one is go to singingriverweightloss.com. There is a little webinar on there that they need to watch. It takes a few minutes, so they need to set aside a little bit of time to do that, and then fill out a questionnaire. That questionnaire will be processed, and somebody will call them. The other way is a new way that we've just started. It is a free seminar. It's going to be live. So one of the surgeons, myself, I'll be doing one next month, will be there. We'll have a little PowerPoint that we'll present to the patient, and they will have them fill out their packet while they're watching the PowerPoint. That will be done here at Singing River Gulfport on the first Monday of every month at 6 p.m.
Okay, all right. And I guess it's best for them to go online and go ahead and sign up for it.
Absolutely.
Or
they can just show up.
Just show up.
Absolutely.
I was going to say something.
Either way.
You might have a packed house there.
That'd be great.
Something like that. Now, will it be in the hospital itself or the medical building next door?
The main hospital downstairs and one of the classrooms.
Okay. So, I mean, that's the easy thing to do if you want to do that. If you've been having some issues trying to get that weight loss, again, for those of you that have more obesity and that morbid obesity, that are, for health reasons as well. Dr. Berglund, thank you so much.
Appreciate it.
Go Tigers.
That's right.
Told him I was from South Carolina too. Anyway, again, Singing River Weight Loss Center, Singing River Hospital's Weight Loss Center here in Gulfport. They do amazing things for you in the weight loss center. So if you want to find out if you qualify for the bariatric program, again, as he said, go online. You can sign up for that or show up first Monday of every month for one of their seminars here. Singing River Health Systems Weight Loss Center.